better health out there is doing it. We're seeing a lot of movement by the folks that are ultimately paying these physicians and their practices to accelerate the adoption of what you're talking about. It is, I think it's a formidable challenge, though, for any practice to incorporate this flood of new information that you described. You've got a wearable, you come in with a 3-month EKG printout, like that's not a 12-minute appointment. And yet your expectations are, look, I've gathered all this data, I want you to interpret it for me. So we have to figure out ways to bring all that back together and make it reasonably efficient. Otherwise, you're just going to continue to create the kind of frustration that I heard you express around the experience of seeking counsel from a physician.
You need to slow down, slow down, slow down, slow down. You need to slow down.
Great time to take a 30 or 60-second break and let you know about one of our amazing sponsors. Let's go see what they're up to.
Do a transition with a group, particularly with Cypress, because of their lifelong relationship with us. They've been present with us for now over 6 years, and I can say that they continue to partner with us in maintaining and growing our practice.
Cypress has helped us to maintain contact with our patients, either by voice shot recordings or email, to give them updates that are timely.
I wasn't expecting to partner with anybody. I realized that I really needed help to make this transition, and ultimately chose Cypress because I felt like they would be able to partner best with me with my own unique needs. They also didn't seem to have one size that fits all. They seemed very willing to partner and figure out what worked best in my specific situation.
They are a godsend to us.
At the last Concierge Medicine Forum, when we were all able to gather live and in person, and we will again, I promise. But we had a group of physicians in Concierge Medicine and an attorney get together for a panel to discuss what the future of medicine is truly going to look like. And one of the things that came out of there, one of the topics, or the phrases that came out of there, the themes, was every doctor is in the customer service business. And I love that, the essence of what that means, because right now, I don't know what it's like to be a doctor, but I do know what it's like to sit on the other side of you. I know what it's like to be sitting in that exam room, feeling all alone, feeling like you're hurried, you're rushed, and I'm not going to get my answers. So earlier this year, we put to the test a topic, which is how do we deliver great, how can we support doctors by delivering great messages of gratitude that communicate thankfulness all year long. So we put together a new course here at Concierge Medicine today, and within this course, you can go to courses over there on the left-hand side of your screen. And we put together a course called How to Implement a Patient Gratitude System. And I know that you're going to want to check it out because we've got something for every single month of the year. And it's just a unique little place, it's a unique little course that offers something unique that you could do to enhance the patient experience, to communicate how thankful you are towards your patients. Because doctors of the future are going to be more concerned, the great doctors of the future are going to be much more concerned about becoming fans of their patients than having it be the other way around. And not only that, not only did we put together this great course for you, we put the course to the test. And we asked doctors earlier this year, and we sent doctors hundreds of thank you notes, personally handwritten by myself, with a gift inside. And you responded in spades. And I have a whole drawer full as well as of all of those notes. So I want to thank you for that. So I want you to go check out our new course, How to Create a Patient Gratitude System all year long with your patients.
I got a feeling deep in my soul, ain't no secret, 'cause everybody knows. I got a feeling I just can't hide, burning brightly, you see it in my eyes.
He is going to teach us how to create an ice pack, right?
So if you
So we're going to go ahead and start with your slides. You have some basic understanding of, you're going to share with us a basic understanding of some slides that you've put together related to how academic concierge medicine programs work inside of a health system or inside of a hospital. And so let's talk a little bit about that. We'll let you go ahead and share some of your slides now, and then we'll have some questions for you, just basic questions at the end.
Okay, let's see if I can share this properly with you. Tell me if you're seeing the actual presentation view.
We are, perfectly.
Okay, good. So, well, this is, the title of this talk is Build It Right, Academic Medical Center Concierge Medicine. When I was brought back into the University of Miami, which is my alma mater, the chief clinical officer in one of our first meetings says, just build it right. And that's what we're trying to do here. And so far, it's been pretty successful. And I'm going to share what I've learned over the last couple of years since I've been back to the University of Miami with you in hopes of starting a discussion and making people feel a little more comfortable about trying to enter into these waters of academic-based concierge medicine. So let's see if I can get the slides to move. Okay. Are you seeing the next slide yet?
No, we're not.
Okay, let's see if I share this in a different way, if I can do that.
No problem. I can look at maybe editing some of this too.
Okay. So give me a minute, Michael. I'm gonna have
Sure.
to get this.
This is why we pre-record.
Okay.
No worries.
I think I might have been sharing the wrong screen. Let's try it this way. Are you seeing that?
Yes.
Okay.
Looks the same.
It's the same.
So sometimes I use my arrow keys, and that advances the slides.
All right, there we go.
There you go.
The only problem is I used to see my. Okay, there you go. Can you still see it?
Yep.
All right, so we can start rolling again, I guess.
Okay.
So this is a little bit about me. My educational background is pretty much in engineering prior to entering the world of medicine. I went to the Coast Guard Academy to study civil engineering. I served in the Coast Guard as an engineer, where I also got my Master's of Science in Engineering at the University of Illinois, before finally my wife allowed me to have a career transition into medicine, and we went to the University of Miami Miller School of Medicine, where they gave me the opportunity to make that transition. My experience in my early career was in the Coast Guard, serving as an engineer for the most part, and then my experience in medicine began at the Cleveland Clinic, Florida, for residency training, and then spending a career there as an internist and executive health director, before moving on to my present role at the University of Miami's Miller School of Medicine, the UHealth system. I presently serve as a reserve officer in the U.S. Air Force. An overview for this talk. I'm going to take you through a bit about the history of concierge medicine from its beginning, the academic setting, leadership support, expectations from the organizational and patient standpoint, the institutional relationships that are key to developing a program like this, Medicare participation, whether you do or you don't, executive health and how that may play a role in developing the concierge medicine piece, expected challenges in a large academic medical center, the resources you may find helpful, and then we'll conclude it at the end. Okay. All right. Michael, did you get those slides or did we miss?
Yep, we're good. I can see history in front of me.
Okay. So in 1996, MD Squared, Howard Marin, started up, I guess, the concept of concierge medicine in Seattle, Washington. And then in 97, Gary Price started his first direct practice in Florida. He opted out of Medicare. This history is not complete. It's just, key key points in time as the concierge medicine practices have evolved in this country. In 1998, Seattle Medical Associates developed, and around 2000, my mentor in the space of academic concierge medicine, John Kirkpatrick, shown in the picture on the right, he's the taller gentleman with the glasses on. He started a concierge medicine practice at Virginia Mason Medical Center, which is still doing well today. And that's the first academic medical center program that we know of, and he's kind of considered a pioneer in this space. In 2000, on the other part of across the country in South Florida, MDVIP started in Boca Raton. That's not an academic-based program, but that's where the idea of concierge medicine started to take shape as well. In 2003, the Palo Alto Medical Foundation Encino practice developed, and then on the other side of the country again, Tufts Medical Center began an academic retainer practice in Boston. In 2010, the University of Alabama Birmingham Community Medical Group started, and Dr. John Kirkpatrick again had a role in helping that program get off the ground, as he did, I guess, with the Mayo Clinic in Arizona. And then in 2012, the Jacksonville facility for the Mayo Clinic started their program. In 2012, also, Atrium Health, Perspective Health and Wellness, formerly known as the Carolina Medical Center, started their concierge medicine program under the direction of Dr. Lori Ayers, who's still running that program successfully today. And in 2014, Duke came online, University of Massachusetts, Massachusetts General Hospital in 2016. In 2017, you had University of Michigan with their Victor's Care program. And then in 2019, the University of Miami UHealth Premier program was launched. And that's what I've been working on since then. So the academic setting, there's pros and cons to this type of environment for concierge medicine. On the pros side, in the pros column, these are not a complete list, but the high points are, it's a leading edge care delivery by top quality specialists. That's kind of what you get in an academic environment. You have top quality physicians, world-renowned specialists, and it's a great platform in which to try and care for people in a preventive manner and a primary care manner. There's research, education, and clinical care all bundled into one type of diverse and somewhat complicated system. Patients benefit as they're guided through a large system by their concierge team. Now the downside or the cons, well, there's medical school and health system bureaucracy that you have to contend with. You have to know how to navigate those challenges. There's large campuses that are sometimes difficult to navigate as well. And then there's always the perpetual billing issues that you're gonna have to contend with in whatever system that you're dealing with. So you see there, the little picture in the middle, you have the medical school, primary teaching hospital, you have the academic health system that bridges between the teaching hospital and the faculty group campus or the faculty group practice. And those systems have to kind of work together harmoniously in order to allow for a concierge medicine practice to work well in that setting. So leadership support. This is really important. You must have the full support of the C-suite and Board of Trustees members in order to go ahead and even think about launching a practice like this in an academic medical center. That support is pretty important, as well as a clear vision with a full commitment to build a concierge medicine practice within an academic medical center. If you don't have a clear vision from the get-go and you don't have the full support of senior leadership and the Board of Trustees, it's going to be harder to launch something like this within an academic medical environment. The reporting structure, we found, should remain simple for the practice leaders. And you want to, for example, you report directly to the Chief of Staff, possibly the Chief Clinical Officer, the Chief Operating Officer, the Chief of Medicine. You don't want to have too many layers in your way so that the ability to adapt and evolve is pretty simple for you as you build this type of practice. You want to identify concierge medicine practice as a retainer-based practice for all of its members, or allow complementary membership to donors and Board of Trustees members. That's another part of the leadership support and how they help define and clarify the vision for this type of practice. And again, the practice should be fully supported, even if it's designed to be a loss leader. For example, if you're just there to help the donors and there's no retainer base to it, you have to make sure that the leadership is in support of that when it comes down to looking at dollars and cents. So organizational expectations. You know, expectations and reality sometimes don't always align. But in this case, while you're starting out, if you're planning to embark on a concierge medicine practice within an academic medical center, you should consider developing a memorandum of understanding with the medical center administrative and physician leadership to address your objective and vision for the concierge medicine program, organizational and reporting structure, Medicare participating versus non-participating commitment, and this is important from the get-go. Clinical staffing needs. Do you need 1, 2, or 3 MDs, APRN, RNs, LPNs, medical assistants, registered dietitians? What are you going to outline as far as your starting team, both on the clinical and the non-clinical side? And you need to pretty much, you know, attract, you know, the well-educated and talented folks into this type of environment, because it is a high-touch, very personal type of practice that you're going to be building for a big center. Who pays and who does not pay the annual membership fee should be identified within that memorandum. And then the non-RVU-based productivity and compensation structure for the physicians and clinical staff. So, since, again, this is a low-volume, high-touch practice, you're not going to be able to measure your productivity by RVUs. So it's kind of important to put that out up front. Now, there's other things that you can put in this memorandum as well. You may decide you have to identify a particular space within which to work and other things. This is just a start when you're considering developing some understanding within your health system and getting people on the same page. And as you move forward, you need to educate and re-educate the administrative and physician leadership about the concierge program's role and its purpose for the health system. It's a small piece of a large system, but it's no more or less important than anything else that's being done there. Now, the patient's expectations. Now, this is a challenge as well. So when patients do enroll in a concierge medicine practice within an academic health system, sometimes they believe that their access is extended to everybody at the system. They should have really good and easy, seamless access to everyone. That's really not the case. You're developing expectations for your patients that their access and their connection is with you as the primary care provider. More time with the concierge physician does not translate to more time with the subspecialist too. Downstream, outside of your practice, in a large academic environment, the specialists are going to be limited in the time they can spend with patients. They don't have the luxury of extended appointment times. 24/7 availability applies to only the concierge physicians within the program. It doesn't apply to all of the specialists downstream. Same or next day appointments as well pertain to the concierge physician, not to everyone else in the health system. Now, hospital care will usually be directed by hospital physicians, while the concierge physician will serve as a collaborative resource for the hospital team, patient, and the patient's family. Institutional relationships. As you would imagine, you're going to need to build relationships in a good way throughout the health system in order to make this work for your patients. So the folks at the top and all along the way, from the CEO, the clinical chairs, specialists, emergency department staff, not just the physicians, but the nurses, the secretaries there in the ER, the hospitalists, the foundation board of trustees, all of these relationships that you build as you build your programs are pretty important. They help make or break a program as it starts up. Again, it's a small piece of a large organization that has to kind of fit in. You want to try and blend with the culture of the academic setting that you're involved in. Normally, you're going to have to kind of look the same as everything else. However, you have to have that high touch and that ability to communicate with your peers, your patients, and everyone else along the way. Even passive resistance can adversely affect the practice, which is why building solid relationships with people within the organization is important. If you wind up keep hitting a roadblock with a certain specialty within your organization, when someone says yes, but then they don't pull through, well, that can be a stumbling block for you and the reputation that you develop as you grow your program. You want to remain under the radar and collaborate effectively with others. You don't need to be a beacon, a light, or something that's in the limelight all the time. You just want to be able to do your job, get things done, help your folks, and help the health system at the same time, patients and providers. You're typically, as you continue to build these relationships, you become endeared by the business development team, emergency department staff, and the hospitalists, because they know that when one of your patients shows up for them to care for, you're going to be there to kind of follow along the way and be able to pick up their care when they leave the hospital environment or leave the ER, and there's really a seamless transition. So the relationship with some of the largest donors who are patients provides program physicians some extra influence within the organization. That's a benefit. So these relationships span in many different directions, but as long as you're able to get along, be kind and caring, pretty much
really great time to take a 30 or 60-second break and let you know about one of our amazing sponsors. Let's go see what they're up to.
What if in the fight against cancer, we had a powerful new technology? A new way to find cancer so it can be treated early. Cancer strikes about 1 in 3 women and 1 in 2 men in their lifetimes in the United States. Nearly half of those cancers will be diagnosed after the cancer has spread. Only 20% of people with late-stage diagnosis will survive 5 years. Important progress has been made in essential life-saving single cancer screenings, but early detection technology only exists for a few cancers. This means most cancer diagnoses simply arrive too late. So to help current and future treatments be more effective, you first need to know you have cancer as early as possible. And at Grail, this is our focus: early cancer detection. Grail's Gallery test is a significant leap forward in the war on cancer and a breakthrough approach to cancer screening. Instead of looking for cancer one at a time, organ by organ, the Gallery test has shown the ability to take a patient's blood sample, applying the latest in technology, driven by genomics, machine learning, and large-scale clinical studies, and identify over 50 different cancers. And if one is present, predict its location with high accuracy. Equipped with this powerful information, doctors have an opportunity to step in and act decisively, potentially before cancer has a chance to spread. So it's time to complement existing screenings and start looking beyond a small number of individual cancers. Because the most important cancer is the one you or your loved one has, and beating it starts with knowing you have it. Grail, early detection for multiple cancers.
Bookstore. We have a lot of sales going on a lot of great books. We've also put up our physician reading list that your peers are saying, hey, I'm reading these books. Would you please let my peers know that this is a really great book and it might be really helpful for you? So we have put that into our bookstore as well. It's over to your left, maybe it's that way. We actually have a sale going on right now on the Expanded Guide to Concierge Medicine. It's a recently updated book. We want you to go check it out. And for the first 10 doctors who order this book, we will include a set of doc socks. These were a big hit last year. I know it might seem cheesy, but these are pretty comfortable. I'm not a doctor, but I've tried these on for size. I'm not these particular ones, but I've tried these ones on for size, and they're pretty comfortable. So I think that for the first 10 doctors who order the Doctor's Expanded Guide, which is on sale in our bookstore to the left, Check it out, and we will include a free pair of doc socks. You don't have to be a doctor to get the socks, so we hope that you enjoy it, and you hope that you'll go check out all of our resources.
So the Medicare participating versus non-participating story, or even opting out. These are all decisions that you need to make before you embark on what you're going to build and how you're going to build it. So the membership fee, if you stay in a participating role, and that's what we did at University of Miami at UHealth, I can speak to that. Going into a non-participating route or an opting out route within an academic setting, I cannot really speak to those pathways. But here, the membership fee covers the following services, and it should be clearly outlined in your agreement with your patients, because you don't want to get into a conflict with Medicare rules and regulations and bring undue attention to yourselves. So, for example, a routine, regardless of condition, or medical necessity annual diagnostic executive style physical exam, or the comprehensive physical exam, is something that should be outlined as being covered by that membership fee. It can be explained in even more terms, as you can see here, and legally and from a compliance standpoint, the more specific you are with what your membership fee covers, the better off you are. And at this point, Medicare still does not cover this routine, regardless of condition or medical necessity, annual diagnostic physical exam. Also, you can include subscription access to an online health data storage and communication facilitation platform. And again, these are legal terms that should appear in a contract or an agreement with your patients to clearly identify what that membership fee is being used for. Now, there's other practice features that you can highlight in that membership fee, or in that not the membership agreement, not necessarily covered by the fee. And you can go ahead and highlight things, but clearly identify they're separate from the concierge medicine services paid for by the membership fees. Those may include little or no wait time with unhurried office visits, same or next day appointments with your concierge physician as needed, convenient on-site laboratory and X-ray facilities, complimentary parking adjacent to the clinic, relaxed office atmosphere, complete with beverages and snacks. You can highlight these, but you cannot say that you're charging for these. This is what we learned as we put together our program and our patient agreement, as we dealt with our legal team and the compliance team. So if you're going to stay in the Medicare participating arena, these are some key things that you want to remember. Now, executive health. Executive health is embedded in many academic medical centers and others, and they've been around for a long time. This is a concierge level service line for a health system, and sometimes this does double as your concierge medicine touch point. So it can be combined with a concierge medicine practice like they do at Duke and at UHealth, where we're building ours concurrently and together. The executive health may remain separate from a concierge medicine practice, such as at Mayo and at Cleveland Clinic. So the patients may benefit from a hybrid model of executive health and concierge medicine. You'll use the same staff to support both programs in the same space. Both are revenue generating programs with shared overhead and expenses that's a benefit to the institution. The same concept of high touch or white glove service is involved in both products or service lines. Stronger physician-patient relationships build through continuity care rather than just doing the executive physical and saying goodbye for a year until you see them again. You get to continue care with those patients and you build better relationships and you start to know one another better. It helps you with their care moving forward, and it helps them feel reassured that you're watching out for their well-being. Alternatively, patients may elect to keep these healthcare encounters separate. For example, you can have an executive physical at Cleveland Clinic, you have a concierge medicine membership at the Mayo Clinic in Jacksonville, and this enables you to have a fresh set of eyes performing the annual executive physical once a year, and then going to follow up with your concierge doctor to continue care based on things discovered in that physical. So expected challenges. Well, naturally, legal and compliance teams are going to help determine how to structure the concierge medicine program within a predominantly not-for-profit institutional environment. So when people start talking about concierge medicine, retainer-based medicine within a not-for-profit environment, people get uneasy and feel uncomfortable and think, boy, this will be a profit-generating entity. But if you go about it and approach it the right way with both your legal and compliance teams involved in developing the program, you can structure it appropriately so they can survive and exist in an academic, not-for-profit institution. Now, getting patients to see preferred or famous specialists in a timely fashion, that's a struggle sometimes. That's where relationship building comes in. You're going to have to be able to reach out once in a while and make sure that you know the folks downstream from you and see if you can help along those lines, or at least be able to access their colleagues to help your patients with their primary and preventive care. Organizational changes. This can affect anybody at any level when you have some turnover in the C-suite, you have restructuring, whether before or after a pandemic, things like that happen, and you have to, adapt as you go. Marketing with limited budgets is always a challenge for this or any other program in your health system. Patient re-enrollment year over year. Membership fee collection sometimes is a struggle. We had some challenges during the pandemic when people couldn't come in. So you have to get creative as to how you can go ahead and maintain members as you go through different challenges in healthcare. Finding the right staff. This is pretty important. The clinical and non-clinical staff need to deliver an exceptional patient experience, and not everyone can participate in this type of environment. So you have to be pretty picky and judicious as when you go through the vetting process for the folks that you bring into your team. So finding the right staff is important and can be a challenge, but once you get the right folks in place, the right processes developed, your product will be great. So these are some helpful resources. Concierge Medicine Today, Michael Tetrault, has been wonderful. It's been a great platform for us to network amongst other doctors with similar experiences and who are like-minded while we launch concierge medicine practices both in the private setting and in the academic medical settings. It's a wonderful resource for us. We found it very helpful, and we often communicate with Michael and his team as we build our own programs. Medical Economics is a great periodical. It's got information and articles from time to time regarding concierge medicine, as well as others. There's other types of practices, direct practices, and whatever else does evolve within medicine. Haitian law. So Jim, pictured here on the left, he's an expert in the field of helping concierge medicine practices, both academically and in private practice, develop their patient agreements and help them set up their practices the right way. His contact information is here. He helped us at UHealth, and he's helped many other organizations and physicians as they launched their own programs. So here, this is an example of concierge medicine today, getting the word out and helping people network. The people that you see in the Concierge Medicine Today top doctors list, biennial recognition 2020 to 2021, those are all resources for us to use. We can contact, we would hope we can contact one another and chat and learn from one another as we build and grow our own programs in whatever environment we're setting it up. Now, the Medical Center and Hospital Concierge Medicine and Executive Health Program websites usually get rated, and Michael Tetrault and the Concierge Medicine Today team kind of highlights those that are doing it well and doing it right. And those are folks that are resources for us too, as we're building our programs moving forward. And you see the names here. Virginia Mason's on there, Duke Health Signature Care is on there, Massachusetts General, NYU Langone, Mayo Clinic. All of these we can learn from one another. And doing this together rather than in silos is much better for concierge medicine within the academic environment and in private practice as a whole. So an example of an article from Medical Economics came out in January of 2020 before the pandemic hit. 5 reasons why 2020 will be a banner year for concierge medicine. And it lists things like physician burnout, the move toward value-based care, artificial intelligence technology, how things are going to be much more diverse in 2020. Little did they know that the pandemic made it even more challenging. Yeah. The appeal of personalized care is reaching a younger demographic, so folks that are in medical school now are starting to learn about this type of medicine. So I think Medical Economics and other peer articles out there will help. They serve as good resources. So in conclusion, the academic medical center concierge medicine programs have existed for nearly 2 decades, almost about 2 decades, and new programs continue to develop. And we started with Virginia Mason in 2000, or in 2020, and many more are online already. The pros usually outweigh the cons when patients enroll in an academic program. I mean, they feel secure when they're in a big academic medical center, and they feel comforted by the fact that you're there to help them navigate this large system, which is full of experts in their subspecialty fields. And they can access them with your care and guidance. You must have full support of the C-suite and board of trustees members with a clear vision to develop a concierge medicine program with an academic center. I mean, if you don't have everybody lined up on the same page, it becomes much more challenging. Properly managing organizational and patient expectations is critical to building a successful program in an academic center. Now, this is important as we talk about relationships that you build. Building solid working relationships within the institution is a must. You can't just sit back and think it's going to happen for you. You have to go out there and meet the folks that are going to help care for your patients downstream. Build those relationships with the folks in the emergency department, the hospitalist team, the subspecialists in cardiology and pulmonology, nephrology, neurology, everyone downstream. And you'll get to know a lot of folks, and they'll get to know you. And it'll just mean better care and hopefully better outcomes for your patients. Executive health programs may evolve into hybrid practices or may remain separate from concierge medicine programs. That's a decision that's up to the institution as they build these. Oftentimes you'll find executive health has been there for a while. Concierge medicine may blend with them, or they may be established separately. Ensure compliance, legal, and marketing teams are involved from the beginning of the program development. Try and get people to work together and have the right meetings, whether it be by Skype or any way else, but get folks on the same page, making sure that you keep in mind that there are Medicare rules and regulations that you don't want to, that you want to stay in compliance with, and not put your institution or your practice at risk. So this is my contact information. My cell phone number is there. If I can be of help to anybody in this environment who's trying to set up a concierge-based academic medical practice, I'd be happy to help. Again, Dr. Conn Kirkpatrick has helped us, and he's been a great mentor and pioneer in the space. And Dr. Lori Ayers has been doing this since 2012 as well, so she's a great resource.
And we're going to hear from Dr. Avallone, more from Dr. Avallone, and more from another speaker, Dr. Ayers, here in just the next session. And so this has been incredibly informative. I think that the frequently asked questions and some of your common questions that have come in throughout this last half-hour session, we're going to answer those in the next session. And so we're excited to speak with Dr. Avallone some more, as in addition to another academic medical center professional and physician, Dr. Lori Ayers. And so Dr. Avallone, thank you so much for all of this content. If you are watching the replay of this, or you're watching the live version of this, please be sure to connect with Dr. Avallone. We are going to we have already created here at Concierge Medicine Today an academic medical center group here within the Concierge Medicine Forum closed community that you're already a part of, that you can join for free and start having these important conversations with Dr. Avallone, Dr. Ayers, and others, and ask those questions. The slide deck will be available, I presume, for them to download the PDF version?
I hope so. I think I just sent it off to you. Hopefully.
Yes, we have it. We'll make that available, and you'll see that in the links above and below. Also, we'll also put it into the Concierge Medicine Academic Medical group that we've created. You can go to your left and click on groups, and you'll see a number of different topics, a number of different groups, and each of those topics, each of those groups is centered around these specific topics. So one might be academic medical centers, one might be marketing your practice, another might be, starting and learning for the first time. This is a complicated topic, and it's not something that can be entered into quickly or very easily. And so you want to do it with assurance and certainty. And Dr. Avallone, you've shed a lot of light into really an unknown, foggy area for all of us. And so thank you for being with us, and we look forward to continuing the conversation in the next session.
Thank you, Michael. It's a pleasure to be here. Have a good day.
Probably a really great time to take a 30 or 60-second break and let you know about one of our amazing sponsors. Let's go see what they're up to.
I value the ability to include lifestyle changes in the prevention and management of disease, which takes significantly more time than a straightforward medical approach.
I really wish my dad and my grandfather, both of whom were physicians, no longer with us, could see my smiling face every day. I come home from the office, walk into the house, and I've got the biggest smile on my face. I feel like I've accomplished something. I'm successful.
I would choose Cypress over and over again.
That this is how we stay in business, by knowing business. And so to us in solo and small group, and especially concierge medicine, these skills are part and parcel of taking good care of the patient.
And it's not the last breakout session we've just unlocked for the day. Don't forget to go back and check out the other digitally unlocked videos that we've released. There's a ton of content, a ton of topics that you're going to want to unpack and dive deeper into in the next few hours, days, and weeks to come. So go back to day 1, 2, or 3 and check out the breakout sessions and the general sessions. Feel free to continue to comment on those sessions, even if you're watching the replays. We're continuing to monitor and watch those threads and try to answer all of your questions and comments as the next few days and weeks unfold. So go check out those other videos in day 1, 2, and 3 because there's a ton of great content. Thank you for doing all that you do. Again, it's not about being the best doctor in the world any longer. It's about being the best doctor for the world, for your patients, and for your local community. And we are for you. Thank you.